All right, for more on this story now, let's welcome CEO of Save Our Children, Gugu Xaba, to weigh in on this particular story. Very good afternoon to you. I mean, not really a good afternoon when we're talking about this very disturbing story, is it, Gugu? Just your reaction then to this matter. South Africans, of course, are angry, rightfully so. There's so many questions around why another child has again been failed by the system, especially when you start looking at the various touch points that are interfacing her story from the accused rapist or the alleged rapist to the child's caregivers, the school, the health fraternity, and so many other layers.
Thank you very much for the questions. For Save the Children South Africa, it's been an issue that we have mentioned and talked about, and also, advocated that there should be change within the home and in society as a whole, because this statutory rape is actually part of an indication of the lack of attention to the harm that has been happening through just plain violence that is meted within a home. And now we are seeing the results of the fact that children that are on their own, making decisions on their own without the support of parents or any other person, then we find ourselves seeing a child that is exposed to a person that can rape them. Now the question would be, how long has the child been exposed to this person? And this very person, because it's a person that is above age, why is it that they don't see that this is violence that is being and that they are meting on this particular child, and it's going to cause destruction to the child, to the life of a child, physically, emotionally, and socially. And why is it that as South Africans, we don't see the violence that each and every day is meted, and it's affecting development in the country and all of these things? So as Save the Children, we have spoken about it, and we still feel South Africans could listen and do something about it to change the situation.
Not too long ago, we spoke to the Premier of Limpopo, Poppy Ramathuba, who also called on the healthcare fraternity to report such incidences. For instance, saying that immediately when she was brought to the hospital, health authorities should have rung the alarm. I mean, we know that, of course, there are so many other layers before she arrived in hospital. But what is your take on that? What is your role, do you think, of healthcare officials that are saying that they have to weigh and balance the fact that, there is that private to the particular patient? But in this case, when we are talking about a child being pregnant, surely there have to be systems in place where those healthcare officials need to ring the alarm.
I do understand the point of feeling like healthcare service providers could have done something about it, but it's late. That is why it's important that we look into how within a household we are seeing violence and reporting it immediately and making a lot of noise about it. Immediately it happens. So the fact that the parents of this child 9 months ago didn't see this as a big problem, this is where the problem is. At healthcare services, we are 10 steps behind the problem. So it's important that in the household, the very child, because when we go deep into this problem right now, I don't think this was a once-off incident that the child was raped. You would find that it happened several times before the child could even report a pregnancy. So I think, blaming healthcare service providers is rather late. More so because the first time this incident happened, the child never told anyone. What is it that we're telling children about anyone touching their body to a point of sexually abusing them? That they should report immediately. They should see it as the worst thing that has happened. Why can't we get these children to talk? There is a problem within a home, not just in the health services.
And I mean, Gugu, your points are very valid, but it's an area where, has been tried and tested for many years where children are known not to talk because of the families that they come from, some of them. In this particular case, we understand that the mother was not there because she works in the farms. But we also understand that she may have confided to a family member that she met this 28-year-old man. But when we look at the child or the Children's Act, rather, there is a section there that compels educators like teachers, police officers, as well as healthcare professionals and other, public servants like social workers to report such matters and to raise that alarm. Surely, if in this whole spectrum of responsibility, we need to start enforcing this Children's Act.
Yes, definitely. Because in a long time, Save the Children has said, we are accepting such kind of harm and normalizing it. Yeah. That is why the first person that was told didn't think it was important for them to talk about it, didn't think it was a serious problem. I mean, the consequences of this teenage pregnancy, they are developmental, they are economic, even family organization is affected by this pregnancy, but no one sees it wrong. So we need to stop normalizing a harm, more so sexual harm that is happening to children, so that we can be able to change development in this country. Thank you.
Gugu Xaba, thank you so much for your time. Really do appreciate it. Of course, Ms. Xaba is the CEO of Save Our Children South Africa.